Hi, Dr. Josh Axe here, Doctor of Natural Medicine and founder of draxe.com. In this video, I'm going to train you on the best sleeping positions. And you may not know this, but there are actually certain sleeping positions that can benefit your health, some that can be detrimental to your health. And for actually everybody, it's not the same. Certain people need to be in different sleeping positions. Here's some things you need to know to start. Sleeping position can impact your risk of certain diseases, including Alzheimer's, Parkinson's, headache, wrinkles, sleep apnea, cramping, neck and back pain, also acid reflux and other digestive issues, liver detoxification, and hormone balance, and a whole lot more. So let's jump right in. Back sleepers, here's some facts and benefits. 8% of people sleep on their backs, and it's actually considered overall one of the best positions for your nervous system. It evenly distributes weight and pressure on the spine, the neck, and the joints. Again, it's better for circulation and reduces pressure on your spinal discs. So if you're a person with low back pain or any type of back issue, this is going to be the best position for you. Two types of sleeping positions for back sleepers. Number one, called the soldier, laying flat on your back with your arms at your side, or a starfish, where you're lying on your back with your arms up near your head, or similar to the soldier, not just to your side. You could also have your hands sort of over your abdomen like so, and both of them are fine, but the starfish for some people can be hard on their shoulder joint, so the soldier position is preferred. Now, for back sleepers, here's some pitfalls and tips. Number one, you can't have too much or too little support under your neck. You want to have a small either neck roll or a thin pillow behind your head and neck while you sleep, and one that's soft and not too firm. Neck needs to be aligned with the spine. You don't want to have it too far off one way or another. It may increase your snoring or sleep apnea. So again, a lot of times I see men that sleep on their back, or some cases women, to where their partner is complaining of them snoring at night, so that can happen. But again, sleeping on your back can be healthy, but it does put you more at risk of snoring and sleep apnea. And again, proper pillow a must. One of the keys that keeps your nose aligned with your sternum. You gotta have a good pillow if you're gonna be a back sleeper. But again, the best ideal position for your lower spine and your discs. Now, next one here is side sleeper. Here's some facts and benefits. 69% of people actually are side sleepers. Now, most common sleep position among people and wild animals, actually many of them, will sleep on their side. Considered okay sleep position, less prone to snoring, decreases pressure on the back compared to the stomach, and lowers your risk of Alzheimer's and Parkinson's. Now, in ancient Chinese medicine, ancient Hebrew medicine, there was actually a rabbi named Maimonides, and he actually said that there's actually benefits of sleeping on your left versus right side, which we'll talk about in a minute. But you can sleep in the fetus position, the log position, or the urinary position, but the fetus position is known as one of the healthiest positions, with a pillow between your legs is the best of all side sleeping positions. Now listen to this. If you sleep on your side, it actually supports your specifically your stomach and your digestive tract after you eat. You can actually continue to digest very well sleeping on your left side. It's optimal for circulation for pregnant women. However, the con is it may strain the liver, the lungs, and the stomach, whereas the right side actually relieves pressure on many of your internal organs and is best overall for the liver. The con is it can increase heartburn slightly. Maimonides, this ancient doctor, said the ideal sleep position is for you to sleep on your left side the first half of the night, and then roll over when you wake up sometime during the night, and those early morning hours, sleep on your right side. This way you're detoxifying and supporting your digestive tract the first half, and then your colon and your liver the second half of the night is what the ancient practitioners taught their patients. Some pitfalls of sleeping on your side. Again, with some people it can cause a spinal curvature, especially if you have a bad bed, compressing certain nerves that run down your glutes and low back. Can increase wrinkles, also can affect your overall neck if you don't have a good pillow. So listen, being a side sleeper can be great as long as you have a good bed and pillow, and ideally you'd sleep on your left side for part of the night, your right for part of the night, if at all possible. Let's talk about stomach sleepers. 7% of people sleep on their stomach, and by far it's the worst position to sleep in. There are really very little benefits. Overall, it can strain your neck and low back, negatively impacts your digestive system, puts more pressure on your heart and lungs, and takes 25% more energy during the night. And again, side sleepers overall, this is not the position you want to be sleeping in. So me, myself, my degree is as a doctor of natural medicine, doctor of chiropractic, and a nutritionist. And with these trainings, I can tell you, I've worked with thousands of patients on the best sleep position and relieving organ dysfunction and back and neck pain. Number one, best sleep position, there isn't a number one. It really depends on you, but it's either going to be your back or your side, okay? If you're going to sleep on your back, you want to make sure you have a good pillow. You want to make sure you're properly supported. On your side, if you're a side sleeper, it's really especially important you have a good quality bed and pillow, and you want to make sure your spine is aligned like this from the side. You could have a significant other take a picture on your phone to make sure it looks like you are lined up when sleeping in the side position. So again, sleeping on your back is great, especially when it comes to low back issues. For organ function, sleeping on both sides during the night can be beneficial, and nobody should sleep on their stomach. Well guys, hey, I hope you've enjoyed this live training video, and hey, remember, make sure to subscribe here to the YouTube channel. I've got a lot of great videos coming out on essential oils and herbal extracts and how to use food as medicine. Hey, thanks for watching these tips on the best sleep position. Hi, Dr. Axe here. I want to say thanks so much for checking out this YouTube video, and also don't forget to subscribe if you want to get more great content on things like herbs, essential oils, natural remedies, and how to use food as medicine. Also, check out more of our content on my YouTube channel. Thanks for watching.